No, I got an email. Who wants to meet?
Okay, welcome, folks, to this afternoon session of the House Human Services Committee. We are wrapping up testimony on H 545 this afternoon. And we do have a new version of the bill on your website, and we also have a combination of different things. We have testimony from people who will be here in person. We also have testimony from people who have submitted written testimony. And so please do look not only at today, but also at last week's, daily dates. Anytime you see an H 545, you can also, if you call it up under the bill and look under documents and witnesses, you can see it that way as well, all in one spot. So we are going to start off with the Office of Professional Regulation at the Secretary of State's office. And Jennifer, welcome.
Hello, good afternoon. May I pull up another chair?
Absolutely. We have a couple of folding chairs right there beside the refrigerator. And while you're doing that, we'll do introductions around the room. And I will start. My name is Teresa Wood, and I live in Waterbury, and I also serve both in Hillsborough and Huntington.
I'm Ingrid Garapano. I live in Essex, and I also represent Essex.
Hey, Julie McGill, and I represent Bridgeport, Middlebury, New Haven, and Weybridge.
Esme Cole, represent Hartford.
Hi, I'm Zon Eastis. I live in Guilford and I also represent Vernon.
Represent Neil, represent Brandon Lonsdale.
Bishop, representative from Colchester.
Hi, good afternoon. Eric McGuire, representative of Rutland City.
Good afternoon, I'm Dan Noyce. I represent Wolcott, Hyde Park, Johnson, and Belvedere.
And then we'll start right over here and go right around the outside.
I'm Terry Phillips, I'm the Executive Officer of Pharmacy with the Secretary of State's Office.
Great.
Michelle Wade, President of Vermont Nurse Practitioners Association. Bridget Morris, with Morris Strategy, I'm here on behalf of the Cross Blue Shield.
Amy Hornblass, Director of Vermont Stands Up.
And Nancy, why don't you go ahead since we're doing introductions?
Nancy Hogue, I'm the Pharmacy Director for Blue Cross Blue Shield of Vermont.
Okay, thank you. And our witnesses. Oh, and Lori, I'm sorry, I forgot. I'm sorry.
Morse Committee Assistant.
Great, thank you. And I'm Jennifer Cullen. I'm the Director of the Office of Professional Regulation. And with me,
I'm Emily Carr. I'm the General Counsel for OPR.
Great, thank you. Floor's yours.
thank you so much for having us today. We appreciate the opportunity to testify regarding H 545. This is an important bill that's going to increase healthcare for Vermonters, and OPR supports this bill. We understand, and there is the Deputy Secretary of State, Lauren Burt. Thanks so much for coming, Lauren. So we understand that you're considering including an APRN and or a pharmacist on the Vermont Immunization Advisory Council in this bill. We support that change. As you know, APRNs provide primary care to a significant number of Vermonters, and pharmacists provide substantial immunization care within Vermont. So we have some recommended language to be added to H 545. To section 1131B, which is the section about membership on the advisory council. And we're supporting a added language, a practicing advanced practice registered nurse licensed pursuant to 26 VSA chapter 28 appointed by the governor, and a practicing pharmacist licensed pursuant to 26 VSA chapter 36 appointed by the governor. OPR has had a strong partnership with the Vermont Department of Health. During the COVID-19 pandemic, OPR and VDH collaborated extensively to ensure that Vermonters were able to access immunizations through their primary healthcare provider, as well as regulated pharmacy professionals. We continued that collaborative work, including on H 545, as well as changes to the pharmacy statutes in Title 26. We understand that there is a possibility of an amendment to this bill that would include modifying 26 VSA Chapter 36, the pharmacy licensing statute. OPR supports this amendment, which would enable pharmacists and pharmacy technicians to provide immunizations that are recommended by the Commissioner of Health.
Vaccines are prescription drugs. When you go into a pharmacy and request a vaccine, it can only be provided if your healthcare provider has prescribed it, The pharmacist prescribes the vaccine for you pursuant to the state pharmacist prescribing protocol, which is laid out in statute. Or the commissioner of the Department of Health has issued a standing order allowing the specific vaccine to be administered to you. Currently, that's only the COVID-10 standing order. Under current Vermont law, pharmacists can prescribe and pharmacists and pharmacy technicians can administer only vaccines that are recommended by the CDC's Advisory Council on Immunization Practices, or ACIP. If ACIP says a vaccine should be based on shared decision-making between a patient and their doctor, then it is not ACIP recommended. When pharmacy immunization protocols were established, ACIP was the consistent national recognized authority providing evidence-based vaccine recommendations. However, this is no longer true. Earlier this year, ACIP stopped recommending any vaccines for COVID to anyone under the age of 65, including pregnant people, and also measles, mumps, rubella, and varicella for anyone. This had an immediate impact on Vermont. For COVID, OPR and BDH were able to mitigate this impact by updating the standing COVID vaccine protocol to remove all ACIP references. We do not have that solution for other vaccines, generally because the underlying statute is tied to ACIP. Because the current Vermont pharmacy law is tied to ACIP recommendations, this interferes with pharmacies and pharmacy technicians' ability to provide COVID immunizations. The proposed amendment to H545 would solve this problem by removing references to ACIP from our pharmacy licensing statutes. And instead, pharmacists would be able to prescribe, and pharmacists and pharmacy technicians could administer any vaccine to patients over 18 that are approved by the Commissioner of Health as part of state protocols, as well as the COVID flu vaccine to patients over 5. This is essentially what they were doing before ACIP's recommendation changed, and it worked well. The new legislation allows the commissioner to recommend immunizations based on those of both ACIP and other nationally recognized non-ACIP health authorities. We've included the amended language in the 2026 OPR bill, which is H588, and it's attached to our testimony this afternoon. And we have no objections to moving this important language into H545. OPR wholeheartedly supports passing the amendment language in any form. We would look to the Legislative Council's advice on whether the language should be contained in both bills and as it moves through the process.
Thank you. Thank you. Questions from committee members? I have a question as back in Jennifer's part of the testimony about the recommendation for the APRN and the pharmacist. And so I don't see anybody from the health department here. So one of the things that they expressed concern about was that expanding the number of healthcare professionals by specific name was then going to result in additional health professionals by name to ask to be included. And so they preferred the language that's in draft 2.1, which is the addition of an additional healthcare professional not already represented.
Yeah.
So I'm just curious about your thoughts about that.
I think APRNs and pharmacists are so vital to immunizations practices in the state of Vermont that it really does make sense to have a dedicated seat on the council. There may be other professionals, health professionals whose practices are kind of tangentially related to immunizations, but for pharmacy professionals and APRNs, it's really a large part of their practice and what they do. So I think our preference would be to have dedicated seats to those folks. That would be our position.
Okay, thank you.
And we did reach out. I watched the testimony from Friday,
Mhm.
and I did reach out to VDH and just let them know that we were going to be making this suggestion. So I assume we have such a great working relationship with them that I assume we'll connect with them more on that.
I mean, I think it is important, committee members to, to recognize it specifically calls out a pediatrician, a practicing pediatrician, and, two individuals who are professors, researchers, or physicians, and specifically calls out a family or internal medicine physician.
As well as a member of the Board of Medical Practice. So there's a lot of physician seats on that council.
I hear the message. Okay, other questions from committee members? And we'll ask Katie what she thinks, and feel free to be in contact with her as well about whether it should continue to flow in both, if for some reason one doesn't seem to move along or whatever. We were concerned because this one, the effective date is being changed to upon passage. And the other one is not likely to pass till much later in the session. And so we didn't want there to be sort of this void in between for pharmacists in particular. So
We're happy to have it in both bills.
any other questions?
So just, because I don't know.
Representative Eustis.
Yeah, thank you. From a technical point of view, it's possible to have identical language in two bills going forward?
Yes, it is. And then if this one moves along and it reaches the governor's desk and is signed, if it makes it all the way through the process, and then either in the House or the Senate, wherever the OPR bill lands, wherever it is at that moment, they would take it out.
Oh, I see. So that's a process that's built in. It would
Insurance.
never get passed.
Yeah, they call it belts and suspenders in the building
Oh, I
sometimes.
see. I like it.
Yeah, so we wanted to include it here just for that very reason I just said about effective dates.
Yeah, thank you. Very good.
Okay. Any other questions? Thank you both for being here. Appreciate it. Thank you for dropping in, Lauren. Appreciate that as well.
Appreciate it.
Yeah, thank y'all.
Thank you.
Would you like to speak?
No, I should need to connect with you really quickly.
Oh, okay. All right.
Thank you so much.
Okay, thank you so much. Is Sebastian joining us via Zoom? Lance? Okay, so Nancy, you're going to get to go next.
Thank you very much. Well, I'm sorry I can't be in the room with you, but I appreciate the opportunity to speak to you from Zoom today. My name is Nancy Hogue. I'm a pharmacist, and I am the pharmacy director for Blue Cross Blue Shield of Vermont. I've been in this role with Blue Cross for about 4 years. And prior to that, I served as the pharmacy director for Vermont Medicaid for 12 years. So I've been involved in the VVPP program, the vaccine purchasing program, for at least 15 or 16 years now, or as in my various roles, my two different roles. So I have been a member of the purchasing committee, the funding, the immunization funding advisory committee, as a payer representative, again, in both of those roles. And have always had a very collaborative relationship with the Department of Health in that role as well. Blue Cross is very supportive of H545. I think it's a bill that we really need at this difficult time. Based on a lot of other prior testimony, I don't think I need to go into detail on that. So we do support the policy objectives of the bill, and we're certainly aligned with providing all of the recommended immunizations to our members, and doing that at zero cost share. We do cover all of these vaccines today that are on the federal vaccine schedule, and we cover them all at zero cost share. And we certainly plan to do that going forward. There really are just a couple of comments that I wanted to make on the bill. We just would like to assure nobody's really sure what's happening in the future with the CDC. And I think Department of Health also testified to this last week that we're uncertain that we will be able to continue to purchase vaccines through the CDC, based on these various schedule changes. And so the bill is importantly talking about having an alternative source of these vaccines. And we would just like to be sure that if we are forced to go that route, because the CDC is not, we're not able to do it through the CDC, that the cost of those vaccines is not more than what we otherwise pay for privately purchased vaccines. So we basically don't want our cost to go up. Our hope is that they will stay the same or go down. And that's certainly what we are hoping, based on what the plan is, what the Department of Health plan is for purchasing these vaccines. So we have some, concern about the cost going up for us beyond what we currently pay for those vaccines that we are privately purchased and reimbursed by the health plan.
Thank you. Oops.
Yep. You feel free to interrupt me.
No, I didn't. I thought I didn't mean to interrupt. I thought you were pausing. So go ahead.
Yep, I just have two other small points. One is I wanted to echo what some other testimony has provided around the language. And I'm not sure if this language changed in the latest 2.1 because I haven't had time to see that version. But the language around individuals domiciled in the state, this may unintentionally exclude some Blue Cross members who live in border states and utilize Vermont providers. So we wouldn't want to have that unintended consequence with that language. So would appreciate, having access for all of our members to the program.
Yes, that language has been changed, Nancy.
Okay, thank you.
You'll see that in the new draft.
Okay, that's great. And then the last comment I want to make is for the Vermont Immunization Advisory Council, and this may already be part of a state board rule. I'm not really sure, but my comment is that conflicts of interest should be disclosed and avoided if possible on that committee. And just to give you like sort of an example, it allows for, say, a researcher to be appointed to the board if that researcher was being funded by pharma and they were doing vaccine research funded by one of the vaccine companies. We just, I think it's important for that to be disclosed and just to avoid any conflicts of interest. And as I said, that may already be a provision for all state boards, but I wanted to just mention that.
I think that's a good question. And, to be honest, I don't know the answer to that in terms of requirement for all state boards about whether there's a ethics, code of ethics. I know as legislators, we have to sign code of ethics and I know in other places they do. It's a good question. We're going to have to look into that one, but I think that's a good point for us to think about and consider as we continue with markup on the bill.
Thank you. And really, that's the end of my comments. I'm happy to answer any questions anyone has.
Thank you. One of the things that you brought up in your comments between the differences between a Vermont vaccine schedule and a federal vaccine schedule or recommendations is something that we actually brought up with the health department in terms of, public information, about all of this actually is necessary. And that's definitely we saw and we heard testimony that around the confusion that happened with the COVID-19 schedule in the fall when, Vermont issued its own recommendation and making sure that healthcare professionals understand what the differences are between the two recommendations and, just so that they know, what's being, done and, understand that their patients, it's still within patient choice about what they received, but that patients know that if they choose the Vermont recommendations, that the cost will still be covered. If they choose the federal recommendation, that will still be covered. So I think that's important in terms of information out. And we did receive confirmation from the health department that that's really one of the things that they're most concerned about. The other thing, though, I guess I have to say that I don't think I can guarantee you that you're going to have the same or lower cost. It could be totally possible. I don't know, but one of the things, and I guess I'm interested in your perspective about this, that we have testimony, we've heard testimony, and I think we also have testimony from MVP that says this, that actually vaccines actually save money from an insurer perspective, in terms of needing to reduce the cost for the diseases that may result if people acquire the disease without having been vaccinated. So I just want to be clear that I can't guarantee that you're going to have the same or lower costs. I can guarantee that the health department is going to do their best to acquire it at the lowest possible cost. And we had some discussion of wanting to make sure that it was not compromising quality at the same time as, just cost isn't the only denominator, I guess, is the point. So I just wanted to be clear about that. We're not going to be able to put in writing in law that says this is going to be at the same or lower cost, because we don't control that here.
Yeah, I understand that. And I wasn't saying like lower than the CDC schedule. We do pay for a number of vaccines outside of the program. So it was, we would like not to see our overall costs on vaccines to go up. But yeah, I understand what you're saying. You can't guarantee how a contract is going to turn out.
Yeah. Or what the market is going to bear, or what pharmaceutical companies charge, or any of that kind of stuff, frankly. So, okay, any other questions for Nancy at this time? Thank you so much, Nancy. Appreciate you being here this afternoon. And members, I would from the insurer perspective, I would encourage you to read the MVP written testimony that they provided that is on our website. Okay, thank you. We are still waiting for Sebastian. No.
Okay.
Oh, okay. I didn't know what you look like, Sebastian. Okay, welcome. Thank you for being here.
Thank you for having me. For the record, Sebastian Arduenga from the Department of Financial Regulation. I think this is the first time I've been in this committee, so it's good to meet all of you. I am testifying on draft 2.1 of H545, which is the newest copy I've seen. So in general, the Department of Financial Regulation strongly supports the bill, and we're supportive of the changes made with respect to commercial insurance coverage of vaccines, which is the the top of page 11 and going through page 10. We believe that the changes will allow Vermonters to continue to receive vaccines that are supported by scientific evidence with no member cost sharing. And at this time, I'm prepared to take any questions the committee has about the role of the department or the portions of this bill that implicate commercial health insurance coverage.
Thank you. Thank you. And thank you for being here and thank you for listening into testimony the other day. Appreciate it. Any questions for this witness? We don't often get DFR, you know, in our committee. We're like, oh, what do we ask DFR? Especially when they agree with the bill. So it's, I think maybe I'll just take the opportunity to ask a question about what kind of oversight and accountability actions does DFR take to assure that, so for instance, in this case, that vaccines are at no cost to the individual? Is it based on complaints if you got a complaint from somebody or?
So in general, the department has two mechanisms for oversight of health insurance companies. One is through the consumer complaint process. So several of you might be aware of an action that the department took back in 2023 to secure compensation for women who had been charged cost sharing for contraceptive services. That was brought to the department's attention through a complaint. The other way that we enforce the law is through examinations. So not just with health insurers, but with other lines of insurance too. We regularly examine the companies that are subject to our jurisdiction and go through their claims to ensure that they're complying with all relevant Vermont statutes and regulations.
Thank you. Thank you. Any other questions for Sebastian? Thank you so much for making your way over here. Appreciate it.
I mean, I head over next door again.
That's great. So I'm going to take just a moment. Amy? Yes. I'm just wondering, we have a little bit of time and this is earlier in the day. Would you like to present your testimony to the committee?
That would be fantastic.
Okay.
Yes, thank you so much.
You're welcome.
Yes, hello, thank you so much.
Sure.
My name is Amy Hornblass. I am Director of Vermont Stands Up. We're representing people of Vermont. We started to come together during COVID, during the lockdowns, people who wanted to have human connection and not stay 6 feet apart and were totally confused by this, adherence to science, which we were not finding in the research ourselves. And so we found each other and an organization grew out of that. I became director last year. And I'm here to testify on House Bill 545 regarding the vaccine. What's it titled again? Vaccine, basically reinstating the vaccine
Immunization and
Immunization schedule.
immunization recommendations.
Thank you. Thank you. Yes. Yes, so I'm here to testify on that. I am a licensed health educator, grades pre-K through 12. And I've been teaching for 10 years in the St. Johnsbury School District. In 2020, when they wanted us, well, first of all, they locked down the school and sent the kids home. And we were meeting by Zoom. And I could spend a whole time testifying about that and how hard that was and how many students we lost touch with. And when they wanted us to come back in the fall and put masks on the kids and on my fellow teachers, they wanted me to enforce these mask requirements. I just could not do that. I'd never heard of masking people, especially children, in all of my years of healthcare. I have worked in human services. I've worked with people with developmental disabilities. I've worked with severely immunocompromised children when they were first integrated in the schools in the 80s. And I have worked with survivors of sexual and domestic violence. So for all of those reasons, I just knew that there was something wrong. with putting face masks on people. And then I had to resign from my position as a health educator. My school board and my fellow, my director, my principal, told me it was a political conversation that we could not have in an emergency situation. And I said, no, it's not political, it's respiration. We're talking about breathing. We're talking about germs. I teach hand washing. I can tell you that these germ factories on kids' faces is not going to be a good thing in a school. We already struggle, with all of that. And so they didn't want to hear from me. So I resigned from my position. I conducted a statewide study called the Vermont Mask Survey. And I surveyed Vermonters on the harms that they were experiencing as a result of wearing masks, particularly in workplace settings where they were forced to work. The minute you stand up, you suddenly need 10% more oxygen just by standing, let alone any exercise or movement, lifting, carrying boxes, checkout clerks. And I've been asking them all during the lockdown, how are you faring under that mask? And they were not faring well at all. However, they were not allowed to resign and collect unemployment like some other folks. They had to keep their jobs. So I conducted this mask survey, surveyed Vermonters, found exactly the same harms that the Vermont Department of Health found when they surveyed Vermonters. However, they were only focused on compliance. A lot of the mask research is only focused on compliance. Are people following the rules? Are they masking? And in some cases, in healthcare settings in Vermont, even to this day, and this policy was pre-existing to COVID as well, we have something called a vaccine or mask policy. A vaccine or mask policy tells employees that if you don't get your annual flu vaccine, you have to wear a mask. A paper blue mask, an N95, they don't care, slap something on your face. And I do cite a court case in my research from up in Canada where they found that was coercion because there is no evidence that these masks will protect others. We could go on and on about the lack of evidence on masks, even in healthcare settings, even for surgeons, even in sterile environments where they are pumping extra oxygen into the room. Even in those cases, surgeons make more mistakes. They are more likely to transmit infections because of the lack of hygiene of a mask. You're going to touch it, and it's going to be wet and moist from your breath, and that building up carbon dioxide underneath the mask reaches toxic levels within just a few moments of wearing a mask, especially if you stand up. If you sit down, it doesn't necessarily. It stays in not healthy levels, but not off the charts. And unfortunately, a lot of the people making these mask mandate decisions were sitting all day if they were wearing masks at all. And so I think there's a big difference there. And so the reason why I'm coming in to speak to this specific bill, we do have a mask bill that we are working on next door in the Health Care Committee that would prohibit mask requirements in schools. But the reason why I'm coming to talk to you today is because I have been bringing my research and the concerns of fellow Vermonters to the Vermont Department of Health for 5.5 years. And I'm just, thank you so much, Chair Wood, for speaking with me and being willing to hear my testimony. This is the first time a public body in Vermont has responded to my request. So I'm very concerned. My experience is not with vaccines. I do not have an extensive background, but I am a research-based health educator. I have an EMT license right now, and I've read all through that EMT book, and I've read all these studies that people are talking about. I have looked for the research that they say proves that vaccines work and are safe, and I can't find it. We have not been allowed to have a coming to the table. We talk about believe in the math and the science, trust the science. It's there. Just trust these experts, but it's not there. And so if we could just come to the table, maybe you have it. Maybe it's, maybe it's like those missing WMDs, maybe it's under the table and maybe I just haven't found it yet. And maybe other researchers like at the Department of Health and Human Services have not found it yet. But why can't anyone show it to us? We have never done a double-blind placebo study on vaccines for children. And we also have not done any long-term studies. This hepatitis B vaccine that you guys are looking at, I believe, that is the main one that people are talking about right now that brought this kind of to the forefront. I believe they looked at the effects on children for 5 days after getting the vaccine on babies. So we don't have the long-term studies. We do know that the ingredients in these vaccines can cause brain damage. I mean, this I know because I've read the science. So my concern is that we have a health department that was willing for 2 years to tell the schools and guide the schools to mask children with no scientific evidence that masks were safe. I do believe personally that those masks in schools were used as coercion once again, because the schools were told and the children were told coming back to school that second year of masking in 2021 that they could remove their masks if the school reached an 80% or higher vaccination rate. So teachers pressured students, students pressured other students, get your vaccine, get your vaccine. We need to take these masks off. They are incredibly uncomfortable to wear. We had testimony at school board meetings across the state. I cite all of this on my personal website, amyvt.com. You can watch testimony from parents saying my child is crying every day. They don't want to go to school. They're getting headaches. Their faces are breaking out. In my school district, I did an information request and I found that one student ended up in the emergency room within 2 weeks of the mask mandate, and that teachers were quitting. You have healthcare providers who have been quitting because they could not tolerate these masks. My concern is that we are going to hand more power and control without a due process, without citizens at the table, to a department that is willing to do this, right? To say, test the kids, put things up their noses every 2 weeks or every week in order to let them stay in school with no evidence that those were safe or effective. Stay 6 feet apart. Remember that? The whole first year of school, the schools could only meet at half capacity. Half the students. Did you understand what chaos that caused in children and family lives? I mean, you can find on school board videos of those school board meetings, even school board members at my own school district in St. Jay were crying, like basically in tears, like this is wrecking our family. And we are, well-financed. We have all the toys and things at home to keep our kids entertained. And our family is cracking apart under this pressure. Please, something has to give here. And what was the reason for it? There was no science behind any of that. And if you look at the Vermont Department of Health website now, you will see that they are no longer suggesting masks, vaccines, or distancing. However, I also was looking up their latest vaccination rates in the schools. And don't quote me, you can find the links all in my letter that I've submitted, but I believe it was about 10% of students are vaccinated for the flu right now, and only less than a third are vaccinated. Less than 10%, 10% are vaccinated for COVID, and about a third are vaccinated for the flu or less. And yet flu rates have dropped since we stopped these mandates. I also submitted, you'll find an attachment that I submitted to Lori. I created a chart, and I've seen charts that other Vermonters are creating and sending to me as director of Vermont Stands Up that show exactly the same thing. Since the Vermont Department of Health implemented all of these COVID interventions, including the vaccine in 2021, our death rate rose by about 16% a year. And now it's down to, I believe, 10% increase. This is off the charts. If you can find insurance companies across the country are meeting over this over the past 3 years, talking about this. Why are our death rates going up? This is not insubstantial. And when I did get to ask Dr. Levine about it on a radio show, and I linked to this, you can hear his response. This is just too small to count. 1,000 Vermonters a year. 1,000 Vermonters, excess deaths are, too small to count. And my argument is we shut down Vermont based on one COVID death. So I don't believe it's too small to count. So thank you so much. I don't know if I've run over the 5 minutes that you snuck me in for.
That's
I'd be more than happy to answer any questions that you have, and I really appreciate it.
Thank you. Thank you, Amy. I appreciate it. No, why don't you stay there in case people have questions?
Okay.
Questions for this witness. I have a couple, Amy. I appreciate the time and energy that you've spent in thinking about mask mandates in particular and the impact. And you know, I think all of us were impacted at one level or another, whether it was us personally or people we knew or, you know, people in our communities. I guess one of the things that I am sort of coming back to as it specifically relates to this bill is your, I want to make sure I'm understanding what the sort of final summary element was, is that, that the feeling that the health department should not be the, I guess, purveyor of recommendations on vaccines. Did I overstate that, or is that,
Well,
could you
perhaps,
maybe summarize a little bit?
yes, and I'm sorry. Thank you for reminding me. I missed my main point because you sort of caught me a little bit off guard.
I realize that. We weren't expecting to sit there.
My main point
Yes.
is I feel like we are at a huge moment of common ground right now. Because now people are saying they don't trust the CDC and they don't want the government imposing their version of science on us. Well, many of us were saying that 6 years ago, right? We were saying exactly the same thing. So we have common ground. Can we just agree that the Department of Health can make all the recommendations they want to? You know, their process, I would love to improve, and we're public input and all of that, but they can make all the recommendations they want. We really need to be careful, though, about people's autonomy, their right to make their own personal health choices. And you guys do have a bill. I don't see it on the wall here, but it is Bill 61. I believe it was in this room. Oh, well, there's 69, but House Bill 61 about bodily autonomy and being able to make your own health choices. Maybe it was passed to healthcare.
Not sure where it is, yeah.
But it was here last year. You know, and so I really want to make sure that as you think all this through, that you are really remembering that we all should have the right to question the science, to review the science, to make our own personal healthcare decisions. So that's really the main point.
Thank you. Thank you. And, you know, I mean, to be clear, that this bill doesn't require anybody to do anything. It is only about recommendations. And so I appreciate you being clear about what, you know, what that main sort of, you know, kernel of point that you wanted to make. Yeah.
And just one other really important kernel of point is that as I go through all of this, I'm realizing the main problem is people are not allowed to hear about the harms of masking. You have never been told that the carbon dioxide under that mask is reaching dangerous levels. Please be careful. Please watch your family members, your loved ones, senior citizens, and well, not only senior citizens, but residents of nursing homes were made to mask, right, for about a year. But guess what? They took the masks off the residents. Why? They were having strokes and nobody knew it under those masks. So whenever we do a medical intervention, we have unintended consequences. No one is sharing the harms of masks. And as far as I'm aware, when you hear an ad on the radio promoting the use of vaccines because the health department is promoting it or a pharmacy is promoting it, you don't get that list of adverse side effects the way you do for any other medication that you hear on TV. Now, I'm not sure. I'm going to be talking with Aaron Siri, who's a lawyer who deals with this tomorrow through a Zoom call. And I want to find out what's the whole, why are vaccines and face masks and other things like this falling in this hole? My whole trouble this whole time in the past 5-6 years has been getting the message out that there are harms. And for some reason, the Department of Health, the mainstream media, public officials, my school board, you know, nobody was willing to let that be known. So I would like to make sure, I don't feel like your bill is really addressing that.
We're not really touching that.
Right.
But you raised an interesting point. I'm just trying to remember. I did get a flu vaccine and I'm glad that I got one. But I'm trying to remember if I was ever given, you know, like when you get a prescription filled, you get the side effects or potential side effects of the medication that you're taking. And I'm trying to remember if I ever got one when I got a flu vaccine. Yeah, I probably did.
So, yeah.
You have to
I-
sign.
And sign it. Yeah. Yeah.
Like a cheat sheet, but not the full box insert, which includes all of the research, what they based it on, and all the potential harms that they found. Yeah, but thank you so much.
Thank you for being here, Amy. I appreciate it. And thank you for, I wanted you to have an opportunity since you were here and it was within your time frame that we had a few minutes to spare. So
I appreciate it. You made my day. Absolutely.
Good job.
Some things here were presented as facts. And I just want to say that these are
Yeah, I
Yeah.
think that it's important for people to read
To do
the
that, yeah.
testimony.
Yeah.
Okay. Okay, so we have our next witness at 2:15, so oh.
Either go now or later, whatever's best for you.
Now it's good.
Okay.
If you're ready.
You guys are okay.
We're ahead of schedule a little bit, so it's all good.
Nice to see you. I wanted, because I know sometimes that happens when I presented before,
Yeah.
you know. I'm okay to sit?
Absolutely,
Okay.
absolutely.
All right, so,
Welcome,
thank you so
Allison.
much. Yes, Allison Descathy. I'm a Danville, Vermont resident, and
Thank you for pronouncing your last name.
I know nobody knows.
I'm not exactly sure how to pronounce it.
I used to be a Walsh.
Oh.
I never had to spell my name or pronounce it, so.
Would, I would have to do
Yeah,
that.
exactly.
But S all the time, right?
Right, yeah, I had to always double check that. So thank you so much for having me. I really appreciate it. And just my background real quick, I have a Master's of Science in Clinical Human Nutrition. I've had a practice in the Northeast Kingdom for 25 years. I also teach at the Vermont State Colleges. I've taught for 25 years there. I teach science, I teach bio, nutrition, wellness for life. So very much in the sort of health realm. And in my practice, as you can imagine, as is the case and is coming up, we all have very different opinions on health and what works for us or doesn't work for us. And what I've certainly learned in my practice in teaching is health is so personal. It's incredibly personal. We're all so different, and really just trying to respect that piece. In my practice, I do work with 200 people who have been vaccine injured or harmed. So this is just sort of going off of what Amy said, very important that I think we realize that vaccine injury is very real. And we have to keep in mind when we're always looking at data and hearing these numbers that that data point is a person, and they were either injured permanently, temporarily, or possibly died. So just the reality around that piece. And I was going to also ask Lori, I'm not sure, I did send in a PowerPoint to put up. I'm not sure.
Do you have a device?
I could open my device if that helps, but I don't want to cut into my time. But I did send it to you.
I responded too.
Oh, you guys have it. Oh, okay.
Well, it's supposed
Oh, okay.
Is it? Okay.
to.
I
Just
just-
was there.
Oh, we just got it in there. Okay.
Okay, so sorry. I'll just try to.
That's okay.
Bear with me, thank you.
Okay, so we have it here, and you can follow along on yours, and we can follow along with you.
Perfect. Okay, that sounds good. Yeah.
If you look at your devices, it refresh if you need to.
Yeah, so just let me know if everybody has it before I sort of plunge in here.
Everybody
I got it.
able to pull it up? Okay, all right, I guess we're good.
Okay, and the other thing that I should mention too, and I'll get to this piece a little bit later, is I'm also one of the co-directors for Health Choice Vermont, and we represent 500 Vermonters who are very committed to informed consent, body autonomy, and ensuring that we always have the ability to make our own private personal health decisions in the state and in our lives. So you can see the second slide really. I just wanted to bring this up because to me, this drives home the point of vaccine injury is real. And this is a girl, Kaylin Matten, who lived in Barton, Vermont. She died of myocarditis from a Fluzone vaccine in 2011 at age 7. She received the vaccine 4 days prior to dying. It took them more than 10 years, but through the National Vaccine Injury Compensation Program, which is designed specifically to deal with vaccine injury, harm, and death, they did receive the highest compensation, which how can you ever obviously compensate for the loss of a child, but they did get $250,000. The full testimony is linked there. The only reason I have her picture in there is because she presented testimony in 2015 and included all of this information. And then the next one, I just pulled out some quotes because again, I just want to go back to the fact that this is really about, real people. And her mother, Nicole, who testified, said, as you guys can see, I was not told that vaccines can cause injuries or death. I was only told the shot would keep her healthy, but that was not the case. Pediatricians are denying that these things happen. And if you ask me, doctors need to be better educated on adverse reactions of vaccines. They should also have to accept liability if the shot they give causes harm, like it did for Kaylin. They would give better information if they had to be responsible for the recommendations. Any and all vaccines should be subject to informed consent and full disclosure and exemptions. The right to say no should always be available since there is risk. And please stop me at any point, or if I talk fast, please stop me. This number here, you can see on the 4th slide. $5 billion, 530 million, 623,153 and 83 cents. That is the amount of money at this time that has been paid out to people who have been injured, harmed, or lost loved ones since 1988.
That was you said it was okay to ask you a question?
Oh, yes, and everything's linked too,
Okay.
yes.
I see the links and thank you for the active links. That's
Yes.
very helpful to be able to go back and see more info.
Yep.
How is that program?
I was
paid
just
for?
about to get, it is a fund, so it actually is paid for pharma. Some people go back and say, oh, taxpayers are paying for that, but I'm just about to dive into it.
Okay,
So if I don't answer your question, just
Okay.
let me know. Yep.
thank you.
Yep, no problem. So the fifth slide, the National Vaccine Injury Compensation Program, federal program created in 1988 to compensate those who've been injured or killed by certain vaccines. The Health Resources and Service Administration, called HRSA, is the agency that administers the National Vaccine Injury Compensation Program. And it was established in 1988 after the National Childhood Vaccine Injury Act passed in 1986. Incredibly controversial. I think it's critical for you all in this committee to keep this in mind moving forward. In 1986, President Reagan signed this act in, and what it did, which has never ever happened and still to this day has never happened to any other industry, is that no person, you can see this on the 7th slide, can bring a civil action for damages against a vaccine administrator or manufacturer for damages arising from a vaccine-related injury or death associated with the vaccine, meaning you cannot sue Big Pharma. Big Pharma is no longer responsible. I hate to say that, but we all know Big Pharma and the opioid crisis. They are literally convicted criminals. Experimentation on children and people in the global south. Obviously, they've paid $1 billion in fines. They have a track record. They have a rap sheet. So now we have protected them from any liability. And instead, if somebody is injured, harmed, or killed from a vaccine, they sue Health and Human Services. And Health and Human Services has the largest law firm protecting them in this case, which would be the Department of Justice. So that's who you're going after if there's any damage. So the reason this happened, I just wanted to just step back for 1 second here. Number 8, why did this happen? Why would they have offered a complete liability shield to pharmaceutical industries? No other product has this liability shield. That's sort of what drives market forces. If you make a car, if you make a car seat, if you make a product, you're responsible for the safety of it, to doing the best job you can. So you can see in 1985, there was a US Senate committee convened to deal with the lawsuits brought by parents. There was a DPT, diphtheria, pertussis, tetanus vaccine that was causing brain injury and death. They found out that it was because it was a live pertussis vaccine. It was not acellular at that point, and it was causing neurological damage. So the vaccine manufacturers were folding. They were getting sued. I have the numbers there. Tons of lawsuits filed. There was only one vaccine manufacturer left at the time. It was called Ladurl. That turned into Wyeth, which then Pfizer bought, I think, in like 2009. But I feel this history is important so you guys can sort of see where we're now landing in the place that we are. So that was why this had passed. And essentially what happened because of that is Americans lost their constitutionally protected right to trial by jury for vaccine damage or death. As I said, no other product is granted this immunity.
Are there any efforts that you know of, at the federal level to try to reverse that?
Yes, there are bills on the federal level and even states who are saying if you're going to, for example, there's many states saying if you're going to advertise your vaccine products, then you are assuming liability in this state. But right now states, and this has been going on really since it passed, since it went into effect in 1988, where they've been trying to say, this isn't acceptable, this isn't okay, because now you can look and see, this is my next 2 slides, what's happened because of that. Pfizer, for example, most profitable drugs, 2019. They are responsible for the safety of these products. I'm sure you guys all recognize Lipitor, Lyrica. I mean, you see them advertised. They've all had a placebo-controlled double-blind study, which is the gold standard. And it's, as you can see here, 2 years to 7.5 years that went on. Vaccines, on the other hand, and again, this is all documented and linked, and I know that it's actually mind-blowing. It really is criminal, in my opinion. You can see the next slide, hepatitis B by Merck. The polio virus, HIB, DTaP, Prevnar, none of them have had a control, or if a control was used, it was another vaccine. You can see the length of days that have been used for follow-up. For example, Hep B, there's only been 5 days of safety review and follow-up for preclinical licensure. There's a lawsuit. This is why we're now kind of landing in the situation we are right now with the hepatitis B. There's been a lawsuit since 2020 because of the fact that there's been, well, I'll show you the timeline I put together. There's been FOIA requests and letters sent to the FDA requesting where is the safety data on the hepatitis B vaccine. They got a document that was 1,294 pages from the FDA that confirmed they've only done 5 days of safety trial study prior to licensing this, which one is against the law, but two, I think anyone can look and say that's not a robust, good study. So this is what the 1986 National Vaccine Childhood Injury Act has resulted in, is really pharmaceutical companies saying, why would we put money into safety testing when we're not responsible for the safety of this product? And that's a real problem. And I will say this has been going on for decades. And I think since COVID, people have sort of opened up a little bit to the conversation of, you know, the trust factor and what are the, why is there a big anti-vax quote unquote movement? Why are people questioning this? So just to point these pieces out. And I just wanted to go through a little history because then I think it might help you understand more of where my, where Health Choice Vermont, as well as myself, have some recommendations for the bill that might be considered.
Can I ask a question? So on the list of the vaccines, you know, and then the number of days and the control, and you know, so are those things that I guess what I'm trying to understand is these things are updated on a periodic basis. So I mean, the vaccines change as it changes. So I'm just trying to figure out how dated is this information and what's the source of
this? This is all active right now. All of these vaccines are active.
Ones that are active right now.
So, these are just 5 examples, but like hepatitis B, that one by Merck is Recumbivax HB. And that one has only been studied for 5 days pre-clinical licensure. But then I'll get to, there's definitely surveillance systems in place to try to catch, is there some damage that's happening? What is the harm caused by this? So this is where we get into this gray area of these have been allowed for licensure for 5 days. There's no long-term follow-up that's happening to understand what are the long-term effects. And I do have something a little bit later and I'll just plug in, but Duke University, along with the FDA years ago, I think it was maybe around 2013, they had done a study and they said for pediatric medication, you should be doing studies at least 6 years because it's very hard to understand for a child if you're talking about neurological or autoimmune conditions that may not come out for several years. So this is sort of one of the crux of the issues where you can see, you know, why were these licensed to begin with? And then the next slide, and this is slide 12. This basically gets to, and again, this is, I know, shocking and might be tough to hear, but this is all on the package inserts. None of the vaccine doses that the CDC currently recommends for routine injection were licensed by the FDA based on long-term placebo-controlled trials. Every single one of them has been either compared to another vaccine in the trial or to a solution that has an adjuvant in it, such as formaldehyde or aluminum or mercury. So it's not been an inert placebo that these have been compared to. And the other thing that's not been studied, which is down on this slide 12, is the fact that the overall childhood immunization program schedule has not been studied to see impacts on a child. Because I don't know if you guys know how many there are right now, but this is my next slide. This is kind of shocking. And I will say, this is where the US is an outlier. We have more than almost twice as many vaccines than any other country. And there wasn't just one peer country. It seemed like that came out in the first thing. There wasn't just one peer country, Denmark. There were 20 peer countries that were looked at. And I did link that in there so you guys can see it. But you can see here on slide 13, in 1980, American children following the CDC immunization schedule received 23 vaccine doses and 7 shots against 7 different diseases, plus 4 oral polio drops. In 2024, the recommended number of routine vaccines had risen to at least 84 vaccine doses in at least 57 shots for 17 diseases, plus the RSV monoclonal antibody immunization for a total of 18. That is more than any other developed nation. And think about what I was saying earlier, if you don't mind me going back to it. Pharmaceutical companies are not liable for the safety of these products, and we do not have robust, durable clinical trials on them. So you can see why there has been, some of the hesitation around this. This is sort of an intense picture in slide 14, but it does show where we were in 1986 with vaccines for a baby compared to 2025, when the pharmaceutical industry lost their liability, or they weren't liable. Slide 15.
When it says
sorry.
utero, are you saying that it's recommended?
Mother. Exactly. Yep.
So that's.
Yeah, I know people would maybe question that.
I
But
would-
it's significant. Yeah, no, absolutely.
Yeah.
And people do, for sure.
Yeah.
And then slide 15, I did link this. This was, and I would suggest in all your spare time, I know you guys are all slamming right now, but this assessment of the US childhood and adolescent immunization schedule compared to other countries, this is what was released that has caused this great stir of, whoa, we just went from 17 to 11, what's happening? So you can see some of the details of where the US really was the outlier, and now we're coming into what's called consensus vaccines. What are other countries doing? What seems safe? What should we go with comparatively? And then just a few more slides. I did just want to walk you guys quick through, if you don't mind, slide 16. The Hep B Recumbivax timeline. I think Hep B has obviously been, a big question right now because of what they've come out to say. But on slide 16. So just so you all know, after the National Vaccine Childhood Injury Act passed and pharmaceutical companies had liability, hepatitis B came out after that in 1986 and was approved by the FDA. It was the first genetically modified virus used in a vaccine, which in and of itself was highly controversial if you talk to any organic farmer who has concerns about genetically modified proteins. Studied for 5 days with 147 children up to, that shouldn't be 19, that should be 10 years of age, my bad. So that should be up to 10 years of age. So October 12th, 2017, Informed Consent Action Network sent a letter to Health and Human Services requesting the Hep B safety data. January 18th, 2018, they received a letter back from them, which failed to provide further clinical trial safety data. Everything's linked. 2 more letters were submitted requesting the safety data. They were ignored. And then Informed Consent Action Network submitted a FOIA demanding a copy of the clinical trials relied upon to license Recumbivax. They received a 1,264-page document confirming the vaccine was only reviewed for a few days post-injection. The FDA refused to respond to further requested clinical trials data. So on September 4th, 2020, that group filed a petition to the FDA, quote, demanding that the licensure of the Hep B vaccine be revoked or suspended until the safety as required by law is determined in a properly designed clinical trial of sufficient duration. There's been no response to this, and I don't know where that case is landing, but there's of course question in my mind, is this some of what's going on with the hepatitis B vaccine because they can't show further research? And then the only other piece here, I think I just had 2 more on this. Informed Consent Action Network, their quote about this petition: there may be some uncertainty as to what is required under federal law to determine that a product is safe prior to licensure, but what is clear is that 5 days cannot possibly be sufficient to meet that requirement. Hence, if the FDA refuses to grant or timely respond to ICANN's petition, we intend to sue the FDA in federal court to demand the license for these vaccines be revoked or suspended until a proper clinical trial is conducted. And this is hepatitis B. And then informed consent. I just want to make sure that we all are clear on the definition of this. This is something that Health Choice Vermont has been advocating for since 2012. Amy obviously referenced it in her testimony as well. Many Vermonters feel strongly about this. I know my patients and my students do. So the American Medical Association, slide 18, Code of Medical Ethics states that, quote, informed consent in medical treatment is fundamental in both ethics and law. Patients have the right to receive information and ask questions about recommended treatments so they can make well-considered decisions about care. Successful communication in the patient-physician relationship fosters trust and supports shared decision-making. And I think that you guys had heard the term shared clinical decision-making. You know, that's one of the things that's coming from some of these changes on a federal level, and that's already happening. And that ideally should be happening. And this is also why primary care is so important. So you can work with a doctor who knows you and knows your history, and you can have a conversation with, and you can make these actual informed decisions. Also in the Public Health Code of Ethics, the American Public Health Association says, quote, the effective and ethical practice of public health depends upon social and cultural conditions of respect for personal autonomy, self-determination, privacy, and the absence of domination in its many interpersonal and institutional forms. Now just getting into informed consent, because this kind of goes to where I feel like just some considerations on the bill. So I had a good talk with Commissioner Hildebrandt, I guess it was last week, and I completely understand where he's coming from a standpoint of I need to secure access to these. I want to make sure that these are affordable, and I want to make sure that insurance is covering it. He's not, as you had already stated, there's not a mandate that's happening here because then there would be chaos in the state health, trust me. But there's no mandate. I know this is like a recommended piece. And so I understand that part of it. Right now, healthcare providers who are giving vaccines are protected because of the National Childhood Vaccine Injury Act. They are protected and indemnified just like the pharmaceutical industry is. So at this time, because everything is on the schedule and they're just trying to break it into categories of shared clinical decision-making or high-risk populations, like basically what they're saying is, you know what? Have a conversation with your doctor. Like my husband and I, we did not do the hepatitis B vaccine for our 3 children. None of us have high-risk behavior. We've never had high-risk behavior. We know our lifestyles. We've been able to meet and talk with, the doctor and just say, this doesn't make sense for us. And so basically, that's what they're sort of encouraging in this. So I also feel like we have to be careful and not let this sort of science and this whole change be politicized and just bring it back to like, calm down and what is this really? And so the hepatitis B vaccine information sheet I have on page 19. And this is right from the CDC website, but these are not considered informed consent. Some doctors will give these, some doctors will not, but the CDC specifically says people sometimes use the term informed consent loosely when referring to a vaccine information sheet. Vaccine information sheets are written to fulfill the information requirements of that Childhood Vaccine Injury Act. They're not as informed consent forms. And this is where some states, you can see on slide 19, some states do have informed consent laws. And this is something that we were trying to do in H61, which is in the healthcare committee, where basically you're saying, part of it is how is a doctor or healthcare providing ensuring that a patient receives informed consent prior to making these decisions. So I'll come back to this, but I just wanted to point out that the vaccine information sheets are not informed consent. And then I do have, I'll get it to you afterward, but the Recumbivax HP, the package insert is 10 pages long. And in section 6 of a package insert for a vaccine, as required by law, they need to list adverse reactions and clinical trials experience. So you can see in this Recumbivax one where it said 147 infants up to the age of 10, and safety monitored for 5 days. So you can see where that comes from. But in a package insert, you can also at least see what are some of the adverse events that we saw. This would be a much better approach to ensuring informed consent, because obviously Kaylin, who died from the Fluzone vaccine, which had mercury, by the way, her mother did not feel that she had received informed consent. And I think it's probably going to vary across the board with doctors and what they're offering or not.
I have a question about that.
Yep.
Allison,
Mhm.
because I guess there would have to be a pretty specific definition of what constitutes informed consent, because I think you talk to any one individual and,
Yes.
so I might believe that a drug that I'm taking, I read the information that comes. I know I can ask a question. I feel like I'm giving my informed consent. I'm taking the drug.
Exactly.
Other people might say, no, that's insufficient and I need somebody to, whether it's a pharmacist or other healthcare professional or whatever, to sit down and talk to me about what are all the side effects? What are the possibilities of that happening to me? What are the benefits? What are the
Exactly.
And so, and
There's no standards,
There's no-
you're saying.
there
right?
isn't, and
Right.
I think it will be different for each person. Do you know what I mean? Based upon their level of understanding medical stuff, their ability to sort of assert themselves in a medical situation, which
Right.
a lot of people do not. They think the doctors know everything.
Right. And that's where I've thought about this as well, because two of the things that I feel like I struggle with the liability shield in this bill right now because they have liability at this point. And if the federal government is going to shift and there's any change there and the state decides to take that on under their recommendations, who's taking that liability? Is that an off-label use that becomes? So I just feel like that starts to get into this gray area. Maybe judiciary will take some of this up.
They're looking at it. But
Yeah.
I think, I guess one of the thing that, this is just me personally speaking, not committee stuff, but
Mhm.
I think that, the bigger issue is the one that you've outlined in the first several slides, and that's the protections that pharmaceutical companies have at
Yes.
federal, at the national level. And
Yes.
that's what we should be attacking, not the healthcare
I
professionals.
agree fully. That would be amazing. And there's definitely model language and bills from many states right now who are attempting to deal with that because it's been going on for decades. And that would force them to do the real clinical trials. I mean, that would get to the heart of the problem.
Yeah.
I mean, that really would.
I mean,
Yeah.
I can see that, I'm trying to think practically. I can see that, companies were being bankrupted. I get that, but like you said, how do you put a price tag on the loss of a child or
No.
an adverse reaction? You can't really, right?
No.
So I can see that there would need to be at the federal level, some sort of limit on the amount of damages that somebody could get, but just to have total immunity, is,
I think it's Representative Massey right now who might have that bill in Congress. And then there's states, Dems, Republicans across different states who are like, absolutely not. We all know Big Pharma's history. Granted, we are happy and grateful for them for the lives they save and the products that they have. But otherwise, we know, they're corporate stakeholder profit,
Right.
so
and they don't have immunity on anything else.
on the other
On the
products.
other products that they
It
sell.
has to be shifted. Thank you for bringing that up. That really is like a significant issue in this whole topic.
Yeah.
Yes, yeah. And then, so I think the other thing I did want to mention is if you guys are moving forward with the liability piece, which I just feel like that's covered that should be looked at more. But H69, we've had in here in the House as a bill, I think for 10 years. Representative Higley, you allowed him to introduce that bill last session. Thank you. And so what all that does is very simple. And to me, if the state is thinking we are going to be taking this level of responsibility, so to speak, we're going to be doing these recommendations for people to consider, then H69, in my opinion, should absolutely be a part of it, because all that does is it says the vaccine adverse event reporting system was put in place by this 1986 law so we could monitor safety, so we could look at safety issues around vaccines. All that does is it requires them to put together a report to present to the legislature annually, so you guys could be like, okay, what's going on? And it would also allow them to see, why did we have 37 kids who had a reaction to this vaccine? Maybe we need to, look into that a little bit more. So I think it would help everybody to, to me, it's a very responsible move with where if the state moves this bill forward and this becomes law, it would just allow a greater sort of surveillance of what's happening in Vermont with vaccine injury and harm. And it wouldn't be a lot because that system is already in place and they would just be compiling and sharing with you guys. So I just wanted to plug that in as an option for consideration. I just think it would make a big difference. And then the other part, of course, is back to what you said, Chair Wood, is the informed consent piece. And I would just also suggest if there is going to be liability given to healthcare providers offering vaccines, there should be some sort of standard procedure that they go to or something that you sign off on that you feel you received informed consent. It seems like whether they take a training video, whether required for licensure, I just feel like that should be explored for. Some doctors talk about it, some don't, but like you pointed out, it's going to be across the board what they do and also what someone expects. So I just feel like that would, to me, just make this whole process cleaner to make sure that people are getting that and are more making a better decision.
So I get that, and I honestly think there could probably be a whole separate standalone bill about informed consent.
Yes.
You know, to be.
We do have one, actually, so that
Yeah.
might be something, yeah.
I think, you know, one of the things, because I'm coming back again, trying to, you know, make sure everybody understands on the same page about this is about recommendations. It's not about requirements.
Exactly, right.
That I, you know, I'd probably be reluctant at this point in time to, you know, try to squeeze something else into the bill. But
I would definitely consider, if you don't mind me saying, that 69, it's.
I hear you.
simple. Yeah, very simple.
Okay, Representative Cole has a question.
Thank you. One thing that keeps coming up for me too, and it seems to be a through line, you know, between the past two presentations, was access to really good, strong data and research. And, you know, in contemporary times, like we've seen major cuts at the CDC for exactly that. And so I'm struggling here, you know, I think this is one of the reasons precisely why we are doing, you know, 545 is to, you know, if the CDC is suggesting that that's not something that they're not valuing at the moment, it's like.
This research, is that what you're saying?
Yeah, based on the way their budget has looked, like something I think that is important to us on the Vermont level, and we need to prioritize that big time. So, yeah, I just.
And I would.
I'm sorry. Can I interrupt just for a moment?
Yeah.
Amy, I'm just inquiring about whether you're recording or not.
Yeah.
Okay, I just think it's important for people who have their back to you to know that they're being recorded.
Oh, I'm sorry.
That's okay. I just noticed it, and I just wanted people with their backs to you to know that. That's all. That's all.
Yeah. I also, on one of the slides, something that stuck out to me was, of course, you had some, you know, major vaccines, and then discussing like the 5 trials or something of that.
Oh, the Pfizer trials?
Or 5, very limited number of trials.
For the vaccines.
Exactly.
Yep.
Yeah. And it just brings me back to history class, and it's not history for everyone because it was lived experience for many, but polio, and that was huge in American history, and not just America, but, you know, around the world. And it's just, I feel like there's that particular slide doesn't capture like the whole story.
Oh, I know. And that's where it was like the short period of time, there'd be so much to go through.
Yeah.
There's a lot on polio.
And
Sure.
Yeah. And I just couldn't imagine a world without that vaccine. I mean, of course, many others, but it's hard. Like, I think there's a much bigger conversation, and I appreciate you are bringing one perspective, and you've thought a lot about this to the table. But this is, you know, huge. And I think our differences between where the CDC is expressing its values, and I agree, you know, liability in pharmaceutical companies is definitely a huge issue to address. But I think we need to demonstrate where we stand in our values and taking care of the health of Vermonters too, in the Department of
Yes,
Health.
and I would love to talk to
Yeah.
you more about the polio piece afterward, because I know that's not the focus right now. But the other thing I would say is that is what many people would argue is actually what's happening on a federal level right now is there hasn't been good solid science around this. The pharmaceutical industry has been not held liable. And we need to relook at this. So there's, again, you always have these like differing perspectives, and that's where I would encourage you. In the last slide, it's a 33-page report that they came out explaining why they changed it. And I think that that is really worth your time to just try to understand if we can remove some of, I know what the spin does and the social media does of it all, of like, let's just get back to real science and demand real science. And that's where I would say that many people are arguing that that's exactly what's playing out right now and happening. Yeah.
When you say that, it's
Excuse
playing
me,
out,
just-
that's what's
excuse me.
happening. I don't know. Oh, sorry, I'm very sorry. Yeah.
Maybe just to close out on my comment too, I would, you know, of course, the world is so politicized right now, especially on this topic. But the science that has been funded through the CDC, these are independent research institutions, so they aren't like, it's not, you know, who's in office necessarily is deciding like which.
Well, they're not independent, if you don't mind me saying, in the sense.
Well, they're
of
universities and
Well, all of
scholars.
the FDA commissioners, and this is my nutrition realm that I teach on for 25 years, all of the FDA commissioners that we've had in the last more than a decade have gone and worked for Big Pharma. And no one more than Scott Gottlieb, who went and worked for Pfizer. And you could talk to Bernie Sanders and Senator Warren because they called him out tremendously because of this revolving door issue. You know, and the CDC does also own 57 patents. So when we start, that's like a whole other rabbit hole, to be honest, of how unbiased are they? You know, how are they doing from a regulating? But I also just don't want to cut into time. Did you have one other question for me? Because I just had one last wrap up.
I'll call on you. I just,
Okay, did you want to? Feel free.
No, I don't.
When I was talking about this and that, if that's what I was understanding, it's more of what they're trying to rectify is the lack of research that many believe has been happening around this topic. So that's what many believe are seeing is we are trying to get down to doing real science. And that's where I would encourage you. And I'll send it to you separately as well, that 33-page report that came out with them explaining and justifying why did we just go from 17 to 11.
and we have that link.
Yes, you do. Yes.
Link right electronically in your testimony. So I
Definitely.
am going to ask you to wrap up,
Yes,
Allison. 'cause
this is just the last piece. So basically just from the Health Choice Vermont crew, as a co-director, we bring together over 500 concerned Vermonters since 2012. We've been advocating for transparency, accountability, and choice in all vaccine and medical policies. Bless you. We're a nonprofit funded only by small donations, and we believe people should have the freedom to choose and the right to refuse. Over the years, we've followed Vermont vaccine legislation closely. Just in our position that parents know their children, family, and medical history best and must be left free to make informed medical decisions for their minor children. That in many cases, vaccination conflicts with deeply held moral, philosophical, and religious beliefs held by families and individuals, and that the state should protect every person's right to hold conscientious objections. That patients and parents deserve to be informed and updated about vaccine ingredients, clinical trials data, and actual outcomes of those who took the products as compared to those not taking the products. And let's keep in mind aluminum, which is a neurotoxin, is in the majority of vaccines. This information is essential for doctor-patient trust and for true informed consent. We also have our position that in no instance should anyone be pressured to take a vaccine, especially by persons who wish to be indemnified from liability, like the pharmaceutical companies. And our position is also that all vaccine reactions should be actively followed, and state and federal policy should be changed accordingly when new safety signals become known, so we can improve outcomes and reduce chronic disease. And just a few last comments, and thank you. Currently, we have some of the most expensive healthcare, the highest vaccination rates, and the worst health outcomes in the developed world. ACIP, the U.S. Advisory Committee on Immunization Practices, is the federal committee that makes vaccine recommendations followed by all U.S. states and is used to build the vaccination schedule now enforced in daycares, schools, and colleges in Vermont. In June 2025, Health and Human Services overhauled ACIP and limited who would be permitted to influence members to reduce conflicts of interest. Then key data sets already on file were reviewed, strong safety signals were examined, and key decisions were made. January 5th, new vaccine recommendations based on a 33-page comprehensive scientific assessment were announced. That's what I've referenced here. Most notably, for the first time in history, ACIP reduced the number of shots they will recommend to parents as universal immunizations. And it is worth noting that the AAP, American Academy of Pediatrics, is not an independent organization, but a 501c3 nonprofit, which until last month received funding from both vaccine manufacturers and the CDC and Centers for Disease Control and Prevention. In December 2025, Health and Human Services terminated multiple federal grants worth 18 to 20 million to the American Academy of Pediatrics. The organization brought in 140 million last year, paid their executive employees over 8 million, spends approximately 1 million a year in lobbying, and gets funding from Big Pharma. We obviously already discussed the 1986 and the PrEP Act. And then basically the last piece that we just had, if you're not able to say no to 545, and obviously I know you have your reasons where you're moving it forward, we just had our last requests. One, protect Vermont's children and adults by ensuring a process for fully informed consent prior to vaccination. We have some recommended language that we've submitted as well. Parents and children have a right to know what's in the vial, safety testing, and effects. Number two, remove the provision in section 218 VSA subsection 1130 AC on page 7, enabling immunity from liability. We do need accountability, and they should be able to stand behind any recommendations. Number 3, add reporting on adverse reactions related to immunizations. As I mentioned with H69, Vermont should be performing active safety surveillance, especially if they move in the direction of H45. Number 4, add funding for the follow-up and assistance for those experiencing adverse reactions. Number 5, learn about adverse reactions and actual health outcomes of vaccinated and unvaccinated populations. And otherwise, we thank you so much, and thank you for allowing me the opportunity to present testimony. And I did put my contact information if there's anything in there, and I'll make sure you guys have all the hard copies, emailed copies of everything. And I'll pass this around as my last. This was just a hard copy for everybody there. Thank you so much for the opportunity.
Thank you, Allison.
Yeah, thank you.
Thank you. Again, thank you for the links to all the documents.
Definitely. I know that's helpful to know what you're looking at.
Very helpful, yes.
Yeah.
Make sure we're talking about the same thing.
Exactly. Yes. Thank you so much.
And I did bring for her handouts, a comparison of the handout that you received from your doctor and the insert.
Okay.
So I'll leave those there too.
Thank you. And Allison, did you submit this to Lori to post?
I'm going to submit that right now.
Okay, all right, so I'm not gonna take a hard copy.
Okay, yeah, so
I like to leave,
and I don't even know if I did enough. Hopefully I did. Okay.
Yeah, a lot of us like the electronic version, so we know right where to find it.
Okay, I've seen it go both ways.
Yeah, and
Thank you
thank
so
you,
much.
thank you, appreciate it.
Yeah, thanks.
Okay, folks, we're going to, let me just see, we have time for a brief break. If I say 5 minutes, can people really do it in 5 minutes?
Yeah.
Okay, 5 minutes, Laurie, thank you. Thanks, Katie.